we have a chance to win. So if you submit your report by Friday, August 22nd, you are going to be entered in a raffle to win a free extra box of books for your site. So there's some little motivation to get it in as soon as possible. And thank you in advance to those who will be submitting soon, and thank you to those who have already submitted. And passing it on to Carrie for our books updates.
Thanks, Veronica. Thanks, everyone, for joining us today. As always, book updates are one of the most exciting things about the program, in my opinion. So we have good news. We will be getting shipments of books shortly. This year, we have purchased books from 3 different publishers, Books for Schools, which we've purchased from them before, lots of different language options they provide us. And it'll be the first time that we've purchased from Candlewick and Capstone, at least in the past 5 years that I've been associated and doing book purchasing. So this is fantastic. We're going to get new titles out there, as well as some of our languages that we really value and need to be providing. So delivery updates, Books for Schools. The books should be arriving at their warehouse the week of August 25th. And they will be shipped out shortly after that in different waves. So we will be providing information and tracking as we get that. It will most likely be in the same format that you've received in the past, which is an Excel document that has your site ID. And then you will look at that site ID to click on the link for your tracking information. And again, they will be sent out in waves. So your shipment might not come in the first Excel document, but they will be shipping over the next couple days, couple weeks sometimes. So stay up to date on that, and we'll be able to provide the shipping information to you so that you're prepared for the delivery. Candlewick books are set to be delivered to their warehouse on September 19th, and so they will be shipped out shortly after that as well. Same thing about the tracking information that will be coming to you. And then Capstone, finally, their updates is still October, November for their delivery. So we'll also provide tracking information as that comes along. For these 3 book orders, you might receive like an invoice or something in your package, but that is being paid for by Reach Out and Read of Greater New York. So for these 3 book shipments, there is no cost on your end. This is Reach Out and Read of Greater New York providing the books for you guys. Some samples of the titles that we have here as well at the bottom. I think we've got a great variety of books this time around as well. Books for Schools especially is able to offer us great prices on their entire catalog, so we do have a lot of variety of titles. As always, if you find yourself running low on books, reach out to our team. Our promise to you guys for joining Reach Out and Read is that we provide 50% of the book needs for your sites. So we're going to uphold that. And if you find yourself low on a couple books, we do have some in the storage unit. We do have some smaller donations that come in. So let us know and we can put you on our list for distribution in the future. I think that's all I had. I guess I'll end by just saying if you have any feedback on the books, any other languages that you need to see, the main area that we would look for that feedback would be in those progress reports. So mentioning Veronica's plea to continue to complete those progress reports. But if you have any specific notes or whatever, feel free to reach out to me or anyone on the team to provide that feedback. And with that, I will pass it back to Jessie, I think.
Thank you, Carrie, so much. Wonderful. So we're going to cover site visits. Next slide, please. So new site quality tool and updates for site visits. Reach Out and Read has updated the tools we use to understand and capture information about site quality. We hope that this change will lead to robust conversations about quality and provide new insights into your Reach Out and Read program. Next slide. This is a national shift. We want to ensure that participating sites see similar outcomes for children, families, and clinicians that are reflected in Reach Out and Read's national evidence model. We want a consistent tool to provide shared understanding of what it means to implement Reach Out and Read at your site. Conversations about quality help us identify the success and opportunities for growth and allow us to partner together to develop plans to continue to improve Reach Out and Read. Next slide. So what's changing? Clinicians before the site visit at the clinic or hospital will receive a survey. This survey is very short. It has about 7 questions only. It's going to take less than 2 minutes, yes and no. But this survey will be anonymous and will not be scored. So the results will be used to inform us about the creation of site action plans that we give after a visit and not for any punitive measures. The site visit conversations may feel a bit different this time around with the new tool and format. Next slide. So Veronica, Tim, or I will be starting to reach out to you to schedule your annual site visit. If you have a preferred date of the week, time during the day, please let us know. How can you best prepare for your site visit? Make sure, as Veronica and Carrie just said, please complete those wonderful progress reports. Ensure your book distribution rate is at least 85%. Confirm that 100% of your providers have completed the core My ROR training, and prepare your waiting room with either reach out and read posters, library information, community resources. And of course, we are aware that every clinic and hospital are different. However, we encourage those reading corners with books, if possible, in the waiting room area. However, we know that once again, because of infectious control, this may not be possible. But please reach out to us with any questions on how to make your waiting room more literacy rich driven. And with that, I'll pass it to our Director of Development to share information about our annual gala celebration.
Hello, can everybody see me, hear me?
Yes.
Hi, I'm Megan. I'm the Senior Development Manager here at Reach Out and Read. Thank you, Jesse, for just giving me a moment to plug our annual benefit, A Book for Every Child. We are really happy to share that as of today, you can purchase tickets or tables or corporate sponsorships. We have the whole lot available online. So that's the QR code. I'm not sure if it's to your left or your right. It's to my left. You can scan that. And then there's also a main email. If you have any questions for us, you can just email us with gala@reachoutandreadnyc.org. But for those of you who have joined us in the past, we always every year do offer complimentary tickets for our medical professionals. We will be doing that again this year. So please stay tuned for that list that we will be sending out, or the form technically for you to submit if you'd like to join us. And of course, we'd love to have as many of you there in the room with us as possible to celebrate not only our Pediatric Impact honorees, who we honor every year, the Pediatric Impact Awards, but we also will be honoring just the great work our community does day in and day out to give a book to every child, to do what we do. So the proceeds from the benefit are really important for our fiscal foundation, and it just asserts our commitment to what we're all doing. So I want to thank you in advance for your support of that night. Thank you for helping us to always make it special and fun and sparkly, and it will be that again this year. And we look forward to seeing as many of you there as possible. So if you have any questions, just let me know. I'm here. Veronica can also answer questions for you on the team if you have any questions. I know you know her a little better than you know me, but we can get to know each other better too. That's it. That's all I have. Jesse, I'll pass it back to you.
Thank you so much, Megan. With that, it is my pleasure to introduce Elizabeth Frenette. Elizabeth is the Senior Health Policy Expert for HealthySteps, a program of 0 to 3. She leads HealthySteps sustainability efforts in New York, working with health systems, key stakeholders, payers, and policymakers to secure long-term funding for services supporting children and their families. She is an amazing partner and friend of Reach Out and Read of Greater New York. Please join me in warmly welcoming Elizabeth Frenette.
Hi, and thank you so much, Jesse. I really appreciate it. And thank you for the invite to get to talk to you all today. I just wanted to set the stage a little bit and gauge everybody's understanding or familiarity with the HealthySteps model. If you don't mind, could you raise your hand or say out loud if you have some familiarity with the model, it's at your practice, you've heard about it before, you know a little bit, you know a lot. Just would love to gauge an understanding of who's in the room. I recognize lots of familiar names, so great. Well, thank you. Yeah, there's a lot of overlap between HealthySteps and Reach Out and Read. So I really, especially in New York, so really appreciate this time and space. Okay, can you go to the next slide, please? All right, so today, if okay, I'll do a quick overview of our agenda. I'll tell you a little bit about the model, talk about some of the evidence, a little bit of our policy and finance work. That's the space I work in. Then talk to you about the Office of Mental Health request for applications due next Wednesday. And then just a bit about, if you're interested and don't already have HealthySteps in your program, just a bit about training and reach. Okay, next slide, please. All right, so what is HealthySteps? It's an evidence-based, interdisciplinary pediatric primary care program. We help promote nurturing parenting and healthy development for babies and toddlers, and particularly in areas where there have been persistent inequities for families of color or with low incomes. So we put a HealthySteps specialist integrated into the pediatric primary care team to provide short-term behavioral or developmental consultation and referrals, intensive services when needed, and overall support universal practice screening efforts. And if you have any questions, I love to have this be totally interactive. So interrupt me, go off mute, like just ask your questions. I can't see all the chat right away. So please feel free to come off mute and ask questions or make comments as you see fit. So would love to have this be really interactive. All right, next slide, please. So HealthySteps is within the pediatric setting, just like Reach Out and Read. How many of you all have HealthySteps and Reach Out and Read together? And if you don't mind, if any of you do, feel free to come off mute and talk about how your two programs might interact. I'd love to hear that if anyone feels comfortable.
Hi, this is Dr. Mendez from Richmond University Medical Center. We are just at the beginning steps of HealthySteps. We haven't implemented it, but we've had Reach Out and Read for decades in our practice.
Wonderful.
And we're looking forward to see how they work together. I would assume part of what we do with Reach Out and Read is encourage parents to read with children, and we start their library early, as you know, as followed as we follow the recommendations, and it works very well, and it's part of just improving development and the interaction between parents and kids, which is what improves development.
I love that. Thank you. I so appreciate that.
This is Dr. Gonzalez. I'm the director of the pediatric clinic at Amherst. And we do have been having the Reach Out and Read for more than 10 years, probably 15. And it's one of my loved programs. I really love it, and it's part of the visit for every child 0 to 5 years of age. But then in addition, HealthySteps, we have experience of 5 years of HealthySteps. And I have to say that it's a program that is really helping our community very much. Interactions between the two programs, I think, other than being in the same department, in the same clinic, they don't directly communicate to each other because Reach Out and Read is given by the providers to the patients, and modeling and showing the book and being part of the developmental that we do in the health maintenance visits. HealthySteps, we have a psychologist, and then it does a higher level of care for the patients that need it, in addition to support all the screeners and everything that we do at a level 1 of as a tier 1 patients. So love both of them. Impossible to work at Amherst without them at this point. But the communication that it goes more is between HealthySteps and the VIP program, which is video interactive.
Okay.
That really works very well because many patients take benefits of both programs, one after the other, and
Yeah.
part of the therapy. So
I hear
just
you. Okay,
sharing
great.
my experience with that.
I really appreciate that. Thank you. Anyone else want to share your experience also, or I can move on too. All right. So why are we in the pediatric practice? I think I am among friends here, so I don't know that how much I need to go over this slide, but as you all know, you all are the most trusted people out there. Families, caregivers trust you more than anybody else, as they should. And it's a non-stigmatized setting, right? And babies go there all the time. So that's why we're with you. Okay, now we can do the next slide, the model. Okay, so this slide is a good indication of the tiers of service delivery. So the evidence-based HealthySteps model is really organized into 3 tiers of service and 8 core components to make sure that all families within your practice with children ages 0 through 3 receive the level of support aligned with their needs. So the model allows practices to really streamline and enhance your implementation of the American Academy of Pediatrics Bright Futures guidelines, supporting the whole family. So HealthySteps helps practices use frequent screenings to help identify whether children are reaching developmental milestones so they can address challenges early and prevent others from occurring in the first place. Results then alert the HealthySteps specialists and team and practice staff to make sure essential referrals and may be used to educate caregivers on how their experiences impact their child's development and their caregiving. For families with specific time-limited concerns, so tier 1 is all those developmental screening, social, emotional, behavioral, screening for family needs, maternal depression screening, and then also just access to the HealthySteps specialist through a phone line or text, email, online portal kind of thing. But in addition, with families with specific time-limited concerns, so above and beyond tier 1, HealthySteps specialists provide mental health consults and in-house support, and they make referrals to resources and programs within your community to really strengthen the quality of relationships and environments that support healthy growing. And they follow up to make sure families are supported. So that's the tier 2 services. So child development, behavioral consults, care coordination, systems navigation, positive parenting guidance and information, and early learning resources. And the early learning resources is really the core component where Reach Out and Read and HealthySteps, I think, are super aligned too. And then for families with more significant risk factors or concerns, the HealthySteps specialist and pediatric primary care provider jointly see the family at well child visits. So families receiving tier 3 services, that bottom box, also receive tiers 2 and tiers 1. Any questions or thoughts about that? And practices choose how they want to tier families. You all know your patients and families best. So that's how tiering is. Sure. Oh, you're back mute. There you are. Good.
Sorry. In terms of that first tier 1, usually how long it take? I'm asking because we are in the process of applying and if we are eligible, like added to our workflows. So to have an idea.
Yeah, it's very variable. So there's a couple components. There's like a technical component of how well you can integrate these screenings within your like electronic health record system. Then there's implementation and workflow challenges around making sure that you develop the workflows for your practice to actually do these screenings universally. And so that can be really variable for a number of reasons. One, practice size, how many providers you have, how many people you need to get on board with whatever sorts of implementation decisions you're making. So it can be really quick if you're tiny. It could take a long time if, you know, you have a clunky EHR system or have a lot of providers to get on board. But that's part of the work, which is really cool about the model. Like, we're with you to help you make those changes. You're not like, the model isn't, we're not saying you have to just do this and go do it. It's more like, let's work on this together as a whole practice to figure out what works best for you all. And it might look different even at your practice between different providers, those workflows. So just want to, I know that's a non-answer, but.
Thank you. I just want to know, it's good to know that you have the flexibility depending on the setting.
Yeah.
So are the screenings meant to, is the idea to you know, really make sure the workflow is there for the team to do the screenings, and then the positives are referred to the HealthySteps specialist, or is the HealthySteps specialist doing screenings as part of their?
Yeah, that's a great question. It's totally dependent on what the practice wants to do. So as a general advice, we don't necessarily recommend that one person is in charge of all the screenings, because people go on vacations, they get sick, you know, there's turnover, any number of things. We recommend a broader approach to create like a systemic change within your practice. So whoever, for example, many practices have front desk staff hand out the screener. Then the workflow is the positive screens go to the HealthySteps specialist and provider jointly. The negative screens, they're negative, right? Like there's a lot of detail within that. So it's a great question, and it's kind of how you want to do it as a practice. And we can share advice and support you working through that and trying to figure out what works best for your practice. Great question.
And then which screening, I mean, you know, we basically do the MCHAT at 18 months, but what are the basic ones that you're trying to, because it's 0 to 5, right? Or 0 to 3?
Yeah, 0 to 3 or 0 to 5. 0 to 3 is required, but you can serve with HealthySteps up through 0 to 5 if you have a smaller practice. So developmental screenings, so not just autism, but child development, autism, social emotional. So if you do the SWIC, there's like a social emotional domain. ASQ SE is the social emotional domain of the ASQ. And then screening for family needs, we don't have a particular screening that we recommend. There's no valid tool for that, but it's screening for what families need. CMS has a new tool that they're paying out to New York through the 1115 waiver. I can talk way more about that if you're interested.
No, I just guess,
and then
you know,
maternal depression screening.
We all do I think this is right. So we all probably do all those questions at our well visits, but we're talking about really a validated tool rather than just, a lot of those questions are taken into, you know, but we're definitely looking to do a validated tool at most visits, pretty much.
Yeah, all of those screenings have validated tools except for the screening for family needs, is my understanding. The CMS tool is the one that you can get paid for through New York, through Medicaid, through the waiver. But and you might have a different understanding. If you know a validated social determinants of health screening, please let me know. But there's lots of tools out there that are basically asking the same sorts of questions of like, does the family have transportation needs, medical needs, like housing, food, those sorts of questions. Any other questions? All right. I want to go to the next slide, please. Does that help?
I have a lot of questions, but I'm going to try to wait for the end. Otherwise, you'll never.
Okay. Well, I'm happy to take them whenever, so totally up to you. Okay, this is just another slide where we list all the core components of the model. So that's all it is, whereas the slide before had them also organized into tiers. Okay, and for the sake of time, I'll move right along. So these are all of our outcomes, all the domains of our outcomes. So screening and connection to services, timely and continued care and vaccinations, breastfeeding and age-appropriate early nutrition, child safety and risk factors for child abuse and neglect, early literacy and school readiness. This crowd knows all about that. social emotional development, maternal depression, and practice and provider impacts. So these are all the domains of outcomes. I'm curious from you all if any of you have particular areas that you're interested in. I'd love to go over 1 to 2 of these, but we don't really have time for all 8. So feel free to speak up and say what your interest is.
I have a question.
Sure, go for it.
Out there, and I don't want to hog this at all, but we're thinking about implementing it. It really seems like you need a very well-trained person to hit all these areas. I'm just curious if there were challenges out there about finding a HealthySteps specialist. It almost seems like you need a counselor, a breastfeeding specialist, a social worker, all wrapped up. Like, where do you find this person?
I will say that the HealthySteps specialists who I know are unicorns, so I agree with that. These outcomes listed are from a variety of different studies. So I would say on the one practice level, you might not see every single one of these outcomes come and look exactly like these data share. But HealthySteps specialists come from a variety of backgrounds, and you could, depending on what your practice needs the most, you could get a different sort of person. It's a competency-based program, so people don't necessarily have to have a certain licensure to be a HealthySteps specialist. There are many HealthySteps specialists who are lactation consultants by training. There are other HealthySteps specialists that are nurses by training. There are other HealthySteps specialists that are social workers or mental health counselors, or were teachers in early education before. People come from a variety of spaces, and it can be hard to find someone. So yeah, I just want to honor what you're saying.
I know that's helpful for me, because I thought I was looking for someone with a master's of, social work with child education background. And I was like, how am I going to find that? But if it really, there's no specific criteria, just what works for the practice, that's helpful.
It's what works best for your practice and who you think would be best to support the families who you serve, right? Like, your community, and it's really about that. And it's a competency-based program. So we have lots of trainings available so that you can get this person up to speed in terms of early childhood development and all of that. And that's very intentional, because workforce it can be really challenging. So great question. Okay. All right, so let's continue on. Next slide so these are some of the just facts and evidence about timely and continued care and vaccination rates. We help timely well-child visits happen and increase vaccinations. Then the next one is about screening and connection to services. So early identification of child and family needs and improved connection to services. I'm sure you all know how hard it is to get kids and families connected to early intervention, special education, all of that. HealthySteps specialists really spend so much time and effort to get families connected to the services in your community that the families need. So this is really an area that many HealthySteps specialists spend a lot of time on. The next one is breastfeeding and age-appropriate nutrition. So with HealthySteps, we found that mothers sustain breastfeeding longer and lower child obesity rates at age 5. So those are the high-level impacts. I can share some of our outcomes in follow-up if people are also interested. Okay, the next one is child safety and risk factors for child abuse and neglect. Fewer injury-related early emergency department visits and reduced risk of SIDS. HealthySteps specialists talk a lot about safe sleep and creating safety practices within the home. Kids are less likely to receive harsh or severe discipline, and there's greater security of attachment and fewer behavioral problems found with HealthySteps families. Okay, the next one is around early literacy and school readiness, and parents are more likely to share books with children and limit TV time. Next one is social emotional development. So with HealthySteps, there's improved screening and higher referral rates for social and emotional concerns, and then better understanding of early childhood development and improved social emotional development for caregivers. This is about caregiver understanding. And then maternal depression, improve maternal depression screening and follow-up, right? Because you all are with HealthySteps, you're implementing all these workflows and strategies to ensure universal screening for maternal depression. Mothers are also more likely to share symptoms because you're all building these trusting relationships with caregivers. Providers are more likely to discuss postpartum depression with families. And then also mothers are having fewer reported symptoms post HealthySteps. Then finally, practice and provider impacts. So parents are more satisfied with their care with HealthySteps. Physicians are highly satisfied with adding this team member to their practice. There's equitable care and lower costs. So sometimes pediatricians have expressed concerns that they'll slow down practice flow, and that actually has not been demonstrated at all. So just want to share that. Okay, next slide. So this is my domain in the policy and finance sphere. So for the first time, our fee-for-service healthcare system is starting to pay for preventive behavioral health support. So New Jersey actually just passed yesterday or the day before an enhanced payment for HealthySteps on well and sick visits. And we're trying to do similar work in New York with New York Medicaid. So fingers crossed on that. We have a bill in both the Senate and the Assembly right now for HealthySteps to pay for HealthySteps basically through Medicaid. So we at the national office are trying to help payers design new preventive behavioral health benefits to help young children and their caregivers at the same time. So this dyadic work. So again, if I had spoken with you a few years ago, I would have probably ended there that, we don't pay for preventive behavioral health, but we're really beginning to shift the paradigm, and it's really exciting. And New York is, I would say, an innovator in this space. Okay, next slide. For the sake of time, I realize we're at 12:39. Okay, so these are some examples of innovative payment mechanisms in different states. I'll share all these slides later with you all, but I want to kind of get to the OMHRFA. Next slide is, this is our new sustainability webpage. So this is work that I do all the time, billing, coding, sustainability efforts. We've got a whole webpage just for New York where we have a ton of resources for you all around billing, coding, documentation, reasons for denials and rejections and all that. We have a cost neutrality tool. We have a return on investment tool, all sorts of things to support you all. Okay, next slide. All right, this is the big one. So if any of you have a phone or anything, you can scan this QR code, and I can also put it into the chat in a couple minutes. But the Office of Mental Health has released this request for applications. The application submission deadline is this upcoming Wednesday, the 13th at 1 p.m. Eastern Standard Time. Questions and answers have been posted to their procurement page, so you can go take a look at that. A lot of commonly asked questions are available there. Then the anticipated notification, there will be, according to the RFA, 44 awards across the states. That's big. By the way, there's no other state in the country that has this type of thing. This is completely unique, especially in this time of unprecedented Medicaid federal cuts. This is completely a state-run award, and it's just in New York. So, and then anticipated notification of awards 10/1, and then earliest contract start April of next year. I can't speak really to the question. I can't really answer any questions about the RFA, but I can say that you can reach out to OMH if you have specific questions about the RFA. I can answer more questions about the model, but I can't answer more questions about the RFA. But there should be Q&A in their procurements page. So you might have a commonly asked question that you could find there. And otherwise, yeah, that's where it is. And I'll pop it into the chat in a minute. Okay. Then next slide, please. Okay, this is just a quick slide about if you're interested, this is how the training kind of begins. We help prepare you, then we do the virtual training, and then we have technical assistance calls over the next year to support you in your implementation. I also explicitly work in New York, so you can call me anytime for any questions. I'm always available. These are like the contract related agreements, but I'm available. I work in New York every day. Okay, and the next slide is what the training is. It's a 3-part training. The first is the what and why of HealthySteps. Then there's an implementation planning call just with your implementation team. And then there's clinical practice. So that's more about like, what do HealthySteps specialists kind of do in the room? That's the training. And then finally, the reach. We have a huge national network, not as big as Reach Out and Read by any means, but a pretty big one and growing. And we have 123 practices alone in New York. So you're among friends. So any questions, thoughts? Sorry, I skipped through there so fast, but I want to make sure you all get your questions answered. And thank you all for those who have asked questions so far. Feel free to come off mute. I want to hear from you. No questions?
Hi, hi, I'm Paulette.
Hi, Paulette.
I was interested in the breastfeeding.
Yeah.
Yeah, because I nursed my daughter for 2.5 years.
Wow, good for you.
Anytime I can get any more information, I do it. Like I'm considering going into like being a lactating consultant.
Mm-hmm.
Because I feel like I'm thriving whenever I'm talking about breastfeeding and helping women who have a hard time producing milk produce milk. So any information I can get on that, I feel like it'll feed my soul.
Yeah, absolutely.
Yeah.
Let me see if I can find some. But yeah, I mean, in terms of HealthySteps, specialists have varied backgrounds. There are many specialists, depending on who the practice hires. Many specialists have lactation backgrounds, and so they support families in a more significant way than HealthySteps specialists who don't have that background. But no matter who they are often trying to support families in what families want to do to feed their babies.
Yes, okay. And I have a few friends who are pregnant at the moment too.
Oh, cool. Here, I'll pop a link in the chat for you.
Appreciate it. Thank you so much.
Sure. Other questions?
Yeah. Hi, it's Leora McGullner from Mount Sinai.
Hi, nice to see you.
Nice to see you. And we have had Reach Out and Read since 1997, and HealthySteps just rolled out. So it's really exciting, and we're all working together on this. It's been fantastic. We're really excited. I know there was a call recently, and I was so happy that you talked about sustainability and reimbursement. And I wonder, I mean, I know that's your jam and that's a major priority. So I'm just wondering how successful, and you've mentioned this a little bit, but how successful it's been in New York.
Yeah.
If it's been, I know we have a psychologist who previously worked in a HealthySteps program. Now our HealthySteps specialist is actually a social worker. How do we manage that? Or how have you found you've been most successful depending on the level or the training of the HealthySteps? Does that make a difference when people are recruiting?
Yeah.
And then the other thing, and I appreciate all your advocacy for getting it funded. And I wonder if you've had any experience like with the Article 28 spaces, like clinics versus any insight or wisdom on that.
Yes. Yes. So I could talk about that for days. I will pop a link in the chat for our sustainability website. I'll say in New York for existing payment pathways, there's a few options. One, there's a community health worker benefit that's now live. I don't know if any of you all have community health workers at your practices, but if you do, there's a payment pathway for supporting them. So that's one. So that's for HealthySteps specialists without a behavioral health licensure. Okay. Then if the HealthySteps specialist in your practice has a behavioral health licensure, either at a master's or doctoral level, there's a preventive psychotherapy benefit that we think is like the best fit for HealthySteps, where basically you can do psychotherapy without a mental health diagnosis, right? 6-month-old babies typically don't have mental health diagnoses unless you have, you know, significant infant mental health expertise and have intervened early and, you know, all of that. So it's really about prevention and promotion, and you can bill Medicaid for that. Then psychologists also can do health and behavior codes. Those are like those are the best sort of fits, but they're also within those, there's a lot of extra stuff, and there's all the screening that you can get paid for and all of that. Does that, and we talked to lots of people who bill in Article 28, so you certainly can bill for HealthySteps there. I also facilitate for the New York HealthySteps Network a monthly sustainability call, so happy to have you all join that if you're interested. Happy to, if you're part of the network like we are, we could set up a call and just talk to you way more in detail about it too. So let me know if that would be of interest or help.
Definitely. Thank you so much.
You bet. Thank you for asking. Okay. Here's a question. Not sure if you mentioned it, I missed it, but do the practices find their own HealthySteps specialists, or does your program find the workers? So your practice finds the specialists, but we have job descriptions. We have guiding questions for your interview with the HealthySteps specialist. We can also post your job to our network. We can post to LinkedIn. So we can help you, but the position is within your practice. Does that help? Of course. Thank you for asking. I'll pop my email into the chat. I know we're running low on time, and you all are very, very busy people. Feel free to reach out to me anytime. I'm always available. Would love to talk to you, answer questions, any of that. I don't know about a copy of, did we record today? Yeah.
Yes.
Probably
Yes.
you can. Okay.
Amazing. Elizabeth, thank you. Thank you so much. That was incredibly informative to our network. As Elizabeth said, we're going to send some resources your way after this call, along with the recording, which will be posted in YouTube just to people that attended today. But before we wrap up, any additional questions that you guys may have for Elizabeth or for us? Elizabeth, could we share the slides?
And yes, Nikia, definitely.
Amazing. And then could we go to the next slide?
100%.
Next slide, Veronica. So before we wrap up, here's a few more important dates that we want you to keep in mind. Once again, progress report office hours, they will happen August 19. Veronica will be hosting them. So if you have any questions about progress report, please pop in. We will make sure to answer any questions you may have. Progress report deadline, one more time, it's September 1st. There's an upcoming race that we're gonna have in November 1st. More information is coming your way. As our development senior manager Just to inform you, our gala is happening October 21st. We're going to have another town hall in November regarding literacy-rich environment in your site. So please stay tuned for that date. And the last but not least, nominations for awards for next year for medical champions will be launching in November 3rd. So please stay tuned for that email as well. Thank you once again, Elizabeth, for that amazing presentation. And thank you to the network for joining us today, this Friday afternoon. We hope you have an incredible rest of your day, and please stay tuned for our follow-up email. Thank you all. Have an amazing rest of your day. Take care.